Sono Elisa Ferrarini e abito ad Alessandria, in Italia, e ho quasi 30 anni e l'osteogenesi imperfetta. Ho sempre saputo di avere l'osteogenesi imperfetta perché me l'hanno diagnosticata da piccola e quindi ho sempre vissuto con questo disturbo. L'effetto più evidente dell'osteogenesi imperfetta sono le ossa fragili, quindi ho sempre saputo che non potevo cadere, non potevo giocare come gli altri bambini perché se cado mi rompo qualche cosa.
Today in Europe, millions of people suffer, like Elisa, from one of around 6,000 rare diseases. These diseases are often inherited, are highly complex and chronically debilitating. They can also be life-threatening. For people who are suffering, the challenges are immense. Because their diseases are rare and specific, the resources that can help them are fragmented across individual EU countries. This leaves far too many sufferers with no access to accurate diagnosis nor to high-quality treatment.
Rare means that patients are rare, but also the doctors are rare, the knowledge is rare. So that doesn't make sense to expect that in every member state you will find a doctor that has the knowledge to do the proper diagnostic of your disease, to provide the perfect expertise of care for what you have.
To tackle the challenges and improve the lives of millions of patients and their families, the EU member states created European Reference Networks, or ERNs, with the support of the European Commission. ERNs are virtual networks of medical teams across Europe that focus their efforts on complex or rare diseases and conditions that require highly specialized treatment and particular knowledge and resources. The main aim of these networks is to encourage and enable clinicians and researchers to share expertise, experience and information with their peers across the EU to offer better diagnosis and treatments.
Only this way open doors to assist our national healthcare systems in their fight against rare and low prevalence diseases. It means added value, which is only possible if we joined our forces.
In 2017, the EU coordinated the setting up of 24 European reference networks, bringing together 900 medical teams from 300 hospitals in 26 countries. These ERNs are organised according to disease groupings to reflect the number and complexity of the different rare diseases. There is an ERN for rare cancers, for skin disorders, for liver diseases, for respiratory diseases, for eye diseases, to name but a few. Rare diseases are also often very complex. They require multiple and diverse skills from medical teams. It is therefore important that the surgeon, geneticist and psychosocial worker all contribute and share their expertise on cases.
Als je richtlijnen schrijft over dit soort patiëntencategorieën, dan krijg je te maken met al die aspecten van waar de patiënt mee te maken heeft. Dus hoe moet hij behandeld worden? Hoe moet de familie gescreend worden? Wanneer komt de geneticus aan bod? Wat moet je precies screenen? Hoe moet je het precies interpreteren? Al die zaken die op ieders verschillend terrein liggen, die komen samen in die groep medisch specialisten.
This interdisciplinary approach is crucial to ensure that the networks are effective.
In our ERN, like the other ERNs, we are setting up the virtual consultation system. We will have experts available for local doctors throughout Europe to provide their expertise in the management and care of a particular patient with a rare kidney condition.
Clinical services in a virtual environment are at the heart of the networks. The European Commission will provide ERNs with a common IT platform, including shared communication and networking tools that all team members can use to easily share their expertise, knowledge and experience of specific disease cases. In addition to these services, European reference networks will also provide other kinds of assistance to doctors, researchers, patients and their families.
Our ERN will contribute to, for example, guidelines, care guidelines, diagnostic guidelines. We hope that we'll be able to develop educational tools and resources, not only for professionals, but also for patients who are wanting to find out more about their diseases and opportunities. We believe that we'll be able to offer a very solid basis for clinical research, because having a critical mass of patients across Europe mean that we can have cohorts collected who will be invited to participate in clinical research and clinical trials.
ERNs were set up first and foremost for patients, and it is these patients who also have an essential role to play as active participants.
Les patients vont intervenir pour mieux définir ce que c'est qu'un parcours de santé et qu'est-ce que c'est que la qualité de vie pour un patient. Il y a des aspects aussi de transition entre l'enfance et l'adolescence, entre l'adolescence et l'adulte, et ça, c'est des aspects très critiques dans la qualité de vie.
We can learn by listening to them in a very systematic manner how we can improve our care. In every activity of the network, we will include the patients. We will listen to what they have to say, and we will tailor the way we write our guidelines and our recommendations and our standards to their needs.
The first contact point for a patient remains his or her own healthcare provider, who, with the consent of the patient, can seek the advice of an ERN. This way, it is the medical knowledge which travels rather than the patient.
We have that opportunity that at the end, for every patient on the territory of the European Union, there is a place for them in the healthcare system. We don't create new silos of expertise, but we bring the healthcare pathway to the patients. It's a wonderful opportunity which can change the life of patients very short term.
The European reference networks provide a very exciting time for us as rare disease physicians. By having this opportunity to work on a European level, we can really collect that data together and enhance the care of our patients.
Quello che mi aspetto dalla European Reference Network è che ci sia più ricerca, quindi anche per le persone, per i bambini che vengono diagnosticati, che ci sia più ricerca per cercare di migliorare la qualità di vita delle persone che sono affette da osteogenesi imperfetta e da altri disturbi rari.
It's also an excellent example of pan-European cooperation and integration. What does it mean? Share, care, and cure. It means that we will see only one way forward, integrating our capacities, cooperating, and of course on the basis of solidarity, helping European Union patients achieve better treatment.
With millions of people affected by rare diseases, the importance of pulling together information and know-how from around Europe is clear. This is where the EU can add genuine value and have a measurable impact on patients' lives.